welcome. Thank you so much for joining us. And today I want to talk to you. We're going to have deeper conversation and dive in because I have a very special guest. Our role in public health is really to bring that awareness and education to our community. In the last video that we did, we talked briefly about the injustices and traumatic events in the wake of George Floyd's death, and now, unfortunately, others. Racism is truly it's a public health crisis, and it has been for centuries. It's our duty as a public health department to address racism, both for our department and as individuals in our county. Last week, we talked about some health disparities specific to LGBTQ individuals and communities. So today, I have the subject matter expert in diversity and health equity to talk with us about health disparity and racism. So allow me to introduce Daniel Joyner. Daniel is our UnityPoint Health Trinity's Diversity and Community Impact Officer. So Daniel, thank you for joining us today for this very important conversation. Could you share with us a little bit about your expertise, your experience, personal experience, professional experience, what brings you to the table as a Diversity and Community Impact Officer, which is a really cool title, by the way.
Sure, and thank you, Christy, for having me here today. Definitely appreciate the invite and look forward to the discussion today. But my role as Diversity and Community Impact Officer is overseeing the diversity, equity, and inclusion strategies for UnityPoint Health in the Quad Cities and Muscatine region. And prior to that, served as our Community Engagement Director in looking at a very similar role, the social determinants of health in our community and how certain groups in our community are impacted by the lack of resources, and how can we work with our community partners to help address those challenges. So moving into this role, definitely excited about it and get an opportunity to not only continue to work with our community partners, but also look internally at how is our workforce developing, and do we have career advancement opportunities for people of color? How are we recruiting those individuals? Looking at our boards and our committees, what is the makeup of that, and is it representative of the community that we serve? And all of these things, the ROI that we always talk about and we keep thinking about, what is our return on our investment as it relates to diversity and inclusion, is really creating a place and a space that is welcoming to our community, that's representative of our community, and it's making an investment in our workforce and really living out our focus values as an institution that takes care of people in our communities.
I love that. And if I could dive into that a little bit, because I think there's so much more to diversity and inclusion within a workplace for strategies besides just putting folks in front of a learning module. Many businesses say, we've covered diversity and inclusion, we've covered diversity, we're good, it's a required annual training. I struggle with that. I struggle with the fact of putting somebody in front of a learning module online, or can you dive into that a little bit more about the intentional work that needs to be done within organizations to really bring about diversity and inclusion?
Well, it's not a check this box type of topic, right? Diversity and inclusion impacts us every day through the experiences that our team members bring to the table when they come to work every day, and just how they work with other people in our organization. So it's a daily conversation that we need to have. It's not just a yearly checkbox of a net learning or an educational module or something that we talk about on occasion, but living our values as an organization means that we have to have sometimes tough conversations about how race and ethnicity and gender and our background as people, as unique individuals, impacts our daily outlook on life. And that also then reflects into how we treat our patients and how we show compassion to our patients in our community and guests that come through our doors.
So it takes a deeper dive and a deeper learning, really, a training, if you have trainings or learning opportunities they're in dialogue with others.
Mm-hmm.
And it's through an evidence-based or research-based and known learning module and conversation that happens with others. It's looking at your best practices, how you're caring for patients, how you're caring for your employees, and all of that. It's really much richer than a one touch point. As you said, I like that. Check the box. We can't check the box. We can't just check the box. We have to have more. It has to be more impactful in workplaces.
Absolutely.
So the goal of public health, and you said something in your work that you have done in the Quad Cities around social determinants of health. And when I hear you say that, I'm like, oh, Daniel's been doing public health for years. He's been doing public health. But the goal of public health is that every person should be able to reach their full health potential. That's something written by the CDC. That is the vision and focus of public health. But many studies from the CDC and the Office of the Minority Health and Health Equity have identified the correlation between, and we know this through our health needs assessment work that we've done also regionally, between racial, ethnic, geographic, socioeconomic groups and lower health outcomes, that there's correlation between that, the social determinants of health and the correlation of the impact to health outcomes. It seems that racism has a large impact on individual and community health, a larger impact. The stressors that individuals experience from racism or unequal or unequal opportunities to gain housing, jobs, that insurance, access to health care, contribute to those lower health outcomes for people of color. So I want to ask, from your personal and professional perspective, what are some actions we can take individually or collectively as a business, as an organization, as churches? So I'm talking to our Muscatine County people, residents. What can we do individually or collectively as businesses, as churches, as healthcare systems, and we have more than just ours in this county, to address our implicit bias, and identify ways that we can work against inequality?
Yeah. So I think first, Christy, is recognizing the history behind racism and inequality in our country. In 1865, the 13th Amendment was there and abolished slavery. That doesn't mean that slavery and inequality just stopped in 1865.
Correct.
So you think about the issues that happened then. So slaves, most of them became sharecroppers following that, but how did they pay for equipment? How did they buy land? And when they did that, they were then again indebted into that landowner or that person who supplied them the equipment. And in some cases, couldn't ever pay that amount back. Does that sound like freedom? No. And you fast forward to 1927, we had a great flood, and Mississippi River flooded, and states in the Midwest and in the South were impacted by that. And in Mississippi, again, that community was nervous and scared that those sharecroppers would leave and never come back and return to work in that space. So what did they do? They had people there monitoring them and making sure that they did not leave that area. Again, does that sound like freedom? So 1865 didn't just end it. As a personal story here, a year later, my grandfather, who's still living today, was born. He's 93 years old. So you talk about, he's still living, and the amount of things that he's seen since the time that he was born until now, and how many conversations he's had about racism, injustice, inequality in our community. These aren't things that just went away. So I think understanding some of that historical context, in that people that are still living today have experienced so much over the span of their life, and now, myself, having those conversations with my grandparents, with my parents, about their experiences and how that impacts me as an individual and how I go about my life in our community. So understanding some of the history behind that, I think, is one thing. talking through these things like we are today and
Yeah.
creating awareness around the different experiences that we have helps us all grow, right? It's not just me coming into a community like Muscatine and fully integrating in my own way, but it is in a sense that it's my unique experience and how Muscatine has welcomed me as an individual and how I've decided to embrace Muscatine as a community. So it's really about, as a community, as businesses, as healthcare providers, creating awareness around the topic, I think is important. Third, I think looking yourself in the mirror. Do you have your own thoughts or biases towards others? I think the simple answer to that is yes. We all have it.
We all do.
Right?
Every single person has those.
We all have
bias.
it.
Yeah.
So the next question then is, how does that impact our decision making? And if it's in a negative way, then you need to recognize that,
Right.
and then change action in that way. So that's where I think the education and awareness of implicit bias becomes so effective, is when you start to recognize your own biases and how you view people, and not allow it to change or impact your decision in the way that you treat them. We should all be treated equally and with respect and dignity. So that's important. And then next, I'd say just look at your practices as a church, as a business, as a municipality, as a community. Just ask yourself, do we have practices in place that are discriminatory in nature? And if the answer is yes, then that next step is let's take action to address those issues.
So I hear understanding history, history that's not erased, history that is evolved over time, intentional, impactful education, and self-awareness. And that one is important to me. Personally, professionally, in my personal life, in my professional life, is that I always say when I'm done learning, I'm done living. Life brings opportunity to continuously learn and deeper understand who I am as a human, how I need to show up differently, how I need to show up better as a mom, as a wife, as a person of faith, as a woman, as a leader in the community. I mean, it's always something running in my head. I feel so many times, Daniel, in conversations with individuals that we all have our own viewpoints, we all have our own experiences, and there's such a desire to be right that it's really hard for people to authentically listen.
Yeah.
So what does that mean? Somebody can sit maybe and listen to history or listen to perspective of how something may negatively impact somebody. But what does it mean to really sit down and authentically listen to someone's experience and history and training? And because I feel like somebody's always trying to think of a message to respond back.
Yeah. And it's tough, right? We're flawed. We're
We
flawed
are.
human beings. So it's hard to do that. But there is something to be said about putting yourself in other people's shoes, right? So if you can imagine some of the pain and the anguish that people have experienced over the years and say, would I want that for me? If that happened to me or my loved one, how would I respond? Would it be fear? Would it be frustration, anxiety, any emotion that you can think of? Putting yourself in another person's shoes is very effective in thinking through, if that was me, how would that impact me as an individual? And then, as a result of that, then, how do I seek help? If that has happened to me, or, and then thinking through, well, I know if that was the case in my situation, this is what I would do. It's hard. Nobody knows exactly what you would do in any specific situation that you haven't experienced yet, and how you would respond to that. So instead of being prescriptive in that way, or just tuning them out and saying, I hear you, actually sitting down and thinking in a thoughtful way, how would I handle that if that was me?
Yeah, and there's There's so much opportunity right now
Yeah.
in the U.S. To listen to people's experiences. I don't know if you're on social media, but I'm on social media platform, and there's a lot of people sharing their lived experiences from all walks of life, all paths of life, and it's so important just to listen. And sometimes it's difficult for me to listen to another side that I don't necessarily agree with, but I know it's important to understand what other person's views are. So that's part of us having conversation today together is really diving into those, more intentional, impactful conversations with each other. Shared experience, lived experience. And you mentioned something I want to, again, dive into a little bit more. As people experience racism, it creates a pattern of ongoing trauma. And as additional, watching, for example, George Floyd, that's a trigger for some people of trauma that they've experienced, whether that trauma be minimal in somebody's eyes or as extreme as what George experienced. Talk to us a little bit about how maybe traumatic events or trauma experiences impact people's overall health and well-being. You mentioned it a little bit, like if people can reach out, they can get help, but continuing to watch, and it's because of social media, it's because of cell phones, it's because of video cameras that we can see. There's an awareness now that these things are happening and have always happened. So what can people do to, one, cope with their trauma, and how do you handle that?
So I think before I answer that question, if I could, I think that's the important piece, is setting the stage in the history behind what's taken place. And the fact that because these experiences have happened, and because they weren't caught on tape doesn't mean that they didn't happen. People have seen these things, have experienced these things themselves personally, and it is traumatizing. Their family members have shared stories. It's traumatizing to hear those things. How someone seeks help or responds to those traumatic experiences is unique and different to them, right? So some may seek professional help by a healthcare provider. Others may go through the church and talk with their pastor or a trusted member of their congregation. Others may talk to just a family member, and others may just keep it in and hold it in, and you don't know how that's impacted them until something else comes up and they respond in a negative way, and then that's where we're only seeing a part of the puzzle. And you're wondering why they responded in the way that they did. And it could be because of these other experiences that they've had throughout their life.
And the one thing I really just want to wrap up in a package that you said is everybody has different experiences. Everybody experiences and responds to trauma differently. So how can others respond to each individual? If you see somebody hurting, if you see somebody experiencing trauma, maybe it's aggression, and maybe it's anger and outrage. How could I, if I see that from another human, what can I do in that moment?
Again, that's where compassion and understanding come into play. In seeing that there is something that this individual is going through, and what is it, and can I help and do anything about it? And it could just be an ear for that person to vent and discuss their frustration with. You could be an outlet to say, hey, they don't know what resources are available to them, and you may be the person that has that knowledge of what's available in the community that they can access. And in some cases, there may not be anything that you can do individually, but understanding that that person is going through something, and trying to help in any way that you can, I think is important.
So that just empathize. Sometimes if you've ever seen my favorite person, Brene Brown, when you empathize with a person, it means you truly just sit with them. And I'm a problem solver, so that's a little bit hard for me sometimes. I'm an empathetic person as well, but I want to hear, I want to listen, and then I want to be like, come on, Daniel, let's get to a solution. Sometimes you just need to sit with that person. And when I said earlier, you need to authentically listen, that's what I'm saying. I'm saying you just sit and you listen and you say, you know what? Can I role play?
Yeah. Go for it.
You say, Daniel, I'm really sorry you had to experience that. That is awful. That's awful. I'm sorry that was something that you had to walk through. I'm here beside you. That's empathizing. Really hard because I want to move to fixing, but if sometimes people just need to be heard, and that's what that means.
Yeah. And the other thing with that too, Christy, that you never really know unless the person's told you the impact that you've had through just sitting with them, or through the small words, hey, I'm here for you. You don't understand the impact that some of those things can have in a person's life when they're going through something. So I think that's what you said is extremely right and important, and it comes down to empathy for that individual, even if you don't understand. Just saying, I'm here for you. Yes, I'm willing to listen. I think is extremely important.
Yeah. So how can we start with individuals? What actions can we encourage individual people to take? So how parents, teachers, trusted adults of youth, what are some things that we can do with individual people?
Yeah, it's a great question. So parents, it's tough, right? Depending on the age of your children, but at times, even if they haven't expressed that they know what's happening, that doesn't mean that they don't know what's happening. And I'll share an example. We were driving in the car not too long ago, and my daughter, who's 7, saw that all the buildings were boarded up, and she asked, what's going on? And we either could take that as an opportunity to say, oh, they're just doing remodeling in the buildings, or take it and have that conversation with her that's fitting, for her age, and having her understand that there's things that happen in life that, it's hard to explain, but we want to give you the information that we can. And if you have questions, come back and ask us. As a parent, you want to be that person that your kids seek for information. And if you're not, then they can get it from other places, and that could be information that you want them to have or not want them to have. So opening that door and allowing children to ask questions. By nature, a lot of them are curious, and will ask the questions, and just being prepared to answer those questions too, I think is important. And if you don't have the answers, then you as a parent take it upon yourself and dig into it a little bit.
So
say,
I
hey,
like
let's
that.
understand
Yes.
it together.
Yes. So you don't have to know all the answers.
You don't have to know all the answers. No.
Yeah, and you can validate your kiddo by saying, "That's a great question.
Yeah.
Let's check into that." And so you're showing your kid you're human
Yep.
as well, because sometimes they think, well, the parents think they know everything.
Yeah.
When you learn alongside your children, that can be pretty impactful to your relationship with them as well.
Yeah.
I really appreciate that perspective. What about teens?
Teens, same thing.
Yeah.
Again, how do your teens like to communicate? And can you use that as an opportunity to sit down with them? If they are on social media, if they're looking at Instagram and Pinterest and Facebook and Snapchat, whatever it is, hey, what are you seeing? What are you hearing? And let's talk about it. Let's have a conversation about it and see where they're coming from. And sometimes their perspective may be completely different than yours or not what you expected them to say. but it allows, again, an opportunity to have dialogue and use it as a teaching moment if there is something that needs to be taught, but also understand what their perspective and viewpoint on current state in our country is, which is extremely important.
It is. I love that
Yeah.
perspective, and it's something that Dwayne and I try to do with our girls who are 16 and soon to be 19 is that.
So that's why you're asking me about the teens, huh?
I'm like, you got any new advice for me? We're trying that, we're working that angle of, I say, I'm just trying to stay curious because it's hard as a parent because you're always seen, I think we were talking about this earlier, you're always seen as the advisor.
Yeah.
And so, Mom and Dad, how are you going to advise me? What are you going to advise me? And right now, I'm staying quiet and I'm staying curious. Same with my husband, same perspective. Because he has his own experience in the world. I have my own experiences in the world. But when we're parenting them, especially at the teenage years, it's that balance of the morals and values that you've invested and nurtured them in. And now you're trying to get them to be a free thinker and think independently as well.
Yeah.
So it's kind of that. It's a tough balance. It is. It is.
Hard, yeah.
And I want to stand beside them and with them in, their views. And if there's anything that would be deeply morally, different than my view, or Dwayne, we'll certainly share that. But it's an interesting, it's an interesting journey, but there are a lot of resources too, and I think we will share those with our audience of how do you talk to your kids about what's going on in the world, and there's just some great stuff out there. I've been intentionally looking at. I know the CDC has stuff. There's a whole bunch of resources, so we'll share those with parents so they know how to talk to their kids at age appropriate levels. So we just went from 7 to 19. And there are lots of ways to have conversations and validate the questions and the curiosity. I wanted to talk about, was there anything more specifically on individuals that you wanted to share before I move on?
Just on the teachers as well. So, teachers or professors, if they're in college, a lot of times, they can be used as an outlet for a child to express their thoughts or feelings about things as well. So if you're a teacher, having that knowledge that, hey, I might get a question that I need to be ready to answer, or if I don't have the answer, how do I then navigate that conversation? And it's such a sensitive topic again. Do you allow the child to have the conversation with their parents or tell them, hey, this is something I think you should share with your parents? Or how do you navigate that? So I don't have any answers for that, but I think it's important to start thinking through if this is me in this situation and I get approached, and this is with anybody, right? If it's a manager of a restaurant or a banker or whoever, if I get approached with this conversation, how am I going to handle it, and what is my role in that conversation?
And it comes down to my perspective looking in is also a sense of safety in the environment in which a person lives in. I feel safe to show up as my authentic self every day, no questions asked. And that, if you can't feel that every day, that's where trauma builds. If I don't feel safe if my daughter didn't feel safe walking into her middle school classroom every day, she didn't feel safe walking in every single day, and she started to get an attitude with that teacher. Well, now we know why, because that teacher was disrespectful to her. She didn't feel safe in that environment. She's waiting for the next attack. She's waiting for the next microaggression.
And think about it, even if the attitude doesn't come out, the ability to learn has been impacted. So you talk about when people are food insecure, because they're so hungry, they can't even focus on the quiz or the test or the literature that's in front of them that they need to learn. It's the same in a way.
It's the same.
Where I've been so disrespected through the course of this class or being at this school, or I've had so many things happen to me that I don't feel comfortable walking in the door. What do you think's on that person's mind every day that they come into class? It's not oh, I need to make sure yeah, that's a part of it, but their ability to learn has been compromised.
Their thought is, when am I going to have to next deflect? Or
Yeah.
when am I going to have to fight back? Or when am I going to have to stand up for myself? Or when am I going to have to shut down? Or when am I just really would love a call to action to school districts, in particular across the state of Iowa. I know we border Illinois. Again, training.
Yeah.
Training for your teachers. We live in a small Midwest community with diverse populations, and I have a desire for there to be more training and implicit bias understanding, and I know there's been some work on trauma-informed care, but understanding how that relates to racism in particular. Any advice on that for larger school systems and learning?
No, education and training is extremely important, and it's a great topic that you bring up because you think about it from a teacher's perspective. If you have thoughts or feelings about a specific group in our community, how do you treat a student in your class that fits that description? And do you treat them differently than you do the rest of the classmates? And you can imagine if the majority of your class is white, majority is black, Hispanic, whatever, and you have that or those few other population groups in your classroom, what that experience is for them. For me personally, I grew up in suburbs outside of Chicago, but I remember being one of 3 black kids in my elementary school. And it, the experience that all of my friends had growing up, and we talked about this later on in life, was different than what I saw as a student growing up, as a kid in that school. So just understanding that piece alone, again, putting yourself in their shoes, right? Could you imagine if you're a teacher if you're an African-American teacher that teaches majority African-American students, what would it be like to teach majority white students or majority Hispanic students? Completely different experience, and it would feel almost like a fish out of water type deal of you're questioning, the curriculum that you're teaching. How is this student responding or not responding to me? And there's so many other questions that flow in your mind because of the cultural differences there, because of the different learning styles that are there, all of those things that teachers need to think about as they have kids in their class that fit different population groups in our community.
Yeah, that's so important. Thank you for that. I know definitely experiences that we have had within our own family, within community. So vitally important. And, there's opportunity again for self-work for each individual teacher. They can own their own work around implicit bias or understanding if I'm teaching a specific group of individuals, what are some things I need to know and understand and be respectful of in that space. So thank you for diving into that with me. Let's talk about the phrase when people say, I'm colorblind. I don't see color. Although there are some people that are truly colorblind, but when they're saying, I don't see your color, Daniel. I don't see the beautiful color of your skin. When they're talking about race, why is that not helpful to the conversation?
Yeah, it's like telling a person you don't see that they're short or they're tall or they have curly hair or they have long hair or you're right. It is a characteristic of that individual that's unique to them, right? So it's almost in a way denying a part of that person. You can clearly tell that I'm African American. To say that you don't see color would not be truthful, in my opinion. So it's not helpful in a way that everyone's cultural background, their physical traits are all unique to them, right? If I told you I didn't see the color of your shirt and the design of your shirt, I don't see that. It's plain gray today, Christy.
Yeah.
You'd be like, no, it's not. I have
picked
some
out a
bread in
nice
here.
shirt today.
Yeah, I picked this shirt out just for me. I look good in this shirt. So having those conversations and saying I don't see color, I don't think it's helpful because it kind of sets the stage of, and I think it's maybe done with good intentions at times of I don't see color. I treat people all the same, or I'd like to say that I treat people the same way. And usually, I've found this to be true in a lot of conversations that I've had when people have said that to me. It's followed by, yeah, I have Black friends, I have Hispanic friends, and so I think at times it's a way to show, hey, I can relate. I have people that are different than I am, but it's interesting when they say that because I don't see color, but I have Hispanic friends, I have Black friends, I have Asian friends.
they do see
so
color.
You do see color. Exactly. So I think it's just, being honest, being open. I see that you're different than I am. I appreciate that, and I embrace that, and I'm happy that we can be friends, regardless of our physical differences.
Right. So it's celebrating each other for
Yeah.
who we are, the each unique individual we're created to be.
Yeah. Stealing a quote from my 3-year-old's book that we just read the other night. It's celebrating the you-ness of you.
Oh.
Yeah.
I love that. Celebrating the you-ness of you. I love that.
Yeah.